Public servants of Lagos State. I'm glad to welcome you to today's webinar. I want to recognize distinguished members of Alausa that are already on board with us. It's a pleasure having you around. This morning, we are going to be focusing on our health, and our topic for today is footwear. When I came across that topic, the first thing that came to my mind is that prayer that is normally offered for the elderly. It means footwear is already accepted as part of our culture. It has been accepted as part of aging process. But today, as we listen to a dentist, we are going to know whether it is actually part of aging process that is acceptable, or is something that at least is preventable. But before we go on, I want to especially recognize the 20th head of service, who is already with us, Mrs. Folashade Adesoye. We are always very glad to have you joining us for this webinar. You are very welcome, ma'am. Before we continue with the webinar, I would like to invite my permanent secretary, my mentor, my leader, Mr. Segun Ajibade, to please, on behalf of the head of service, declare the webinar open. You can unmute, sir. Please unmute, sir, and declare the webinar open.
Good morning. First and foremost, let me say good morning to my Oga, former head of service, Mrs. Folashade Adesoye. Thank you for coming on board. We enjoy your support at all times.
Good morning.
We love the support you have given both morally, intellectually, for being part of this. It gives it strong credibility when we have people like you on board. So I want to say a very thank you to you, ma. And you're welcome. Good morning, ma.
Yeah.
And good morning to other participants, retirees. God will continue to sustain and be with you. You have the greetings from my head of service, Mr. Akim Okola. He loves to join us. He has promised that one of these days he's going to partake in this webinar. But because of the exigency of duty, which you are quite aware of, particularly at this moment in the state, there are a lot of burning issues he has to attend to. Hence, he could not join us in this webinar. All the same, the topic for discourse that concerns our dental is very germane. As you know, we learned from authority that most of the disease or health issues we have transmit through the teeth. Goes through there because it has an opening, and we chew, we open our mouths, we do all these, everything we put in our mouth. It has become a very serious issue. So the extent that I have a friend who was advising me that my daughter, who is a dentist, should be made to travel abroad, that one of the major problems they have there is dental issue. So it is an opportunity for us, at least to be abreast of what can we do, what are the guidelines to avoid most of these diseases. Not necessary to take or whatever is related to the teeth alone, but inwards, other diseases can be transmitted through the mouth, through what we eat, through what we put in our mouths, So it's quite apt to have a professional to really tackle this issue for us. I'll be part of it because I also want to learn and gain one or two things. So I will admonish us to please, let's be attentive to it, especially at this age we are. The category of people we are attending to, retirees, is very germane that we are very attentive and we listen and ensure that we put to practice whatever we are taught to avoid some of these health-related issues that can be transmitted through the mouth. So on this note, on behalf of my head of service, who has sent his goodwill, I want to declare the webinar open and wish us a successful deliberation. Thank you and remain blessed. I'm also with you. I'll also be asking questions where need be. Thank you and remain blessed.
Thank you very much, sir. Once again, distinguished retirees, the 20th head of service, we are so glad to have you around, and other retired permanent secretaries and heads of service in the house, you're welcome. Today, we have Dr. Mrs. Olasumbo-O as our facilitator. She's a principal dental officer and an assistant director at Lagos State Ministry of Health. She studied dentistry at the College of Medicine, University of Ibadan, and had a master's from University of Lagos. She has over 13 years experience in clinical practice, and she's presently the head of dental unit in Staff Health Services, Lagos State Ministry of Health. Please join me to welcome Dr. Mrs. Olasumbo-O as she takes us on this topic, footwear. Dr. Ayeni Olasumbo, you have the floor now.
Thank you very much, Ma. Thank you very much.
You're welcome.
Thank you, Ma. I want to appreciate the Office of the Head of Service, especially for this wonderful opportunity. And I want to recognize the presence of the 20th head, the 20th head of service, Mrs. Folashade Adesoye, who is in our midst. Also, I want to appreciate our daddy in dental, at the PS of Public Service Office, Mr. Samson Ajibade. I want to appreciate everyone present, the retirees, because I believe this program is for retirees. It's my pleasure to be here, and I want to welcome us all to this wonderful edition. I'll be sharing my screen soon. Please, can I be permitted to share my screen? The topic before us is toothwear. I'll be speaking on this topic in the next 20 to 30 minutes. This topic is important because, screen share, okay? Am I still on?
You are on,
okay.
Go ahead.
Okay, this topic is important because of it mostly affects this age group, the retirees that we'll be talking to today, although it can also be found in young people. But you know, I think the whole Office of the Head of Service wants our retirees to always look good, smiling with bright teeth. And that's why we want to be sharing this topic today. So once again, I appreciate you all for being here, and I appreciate this opportunity. I'm Dr. Ayeni Olasumbo-O, an Assistant Director with Staff Health Services, Lagos State Ministry of Health. So I'll be discussing, okay, sorry. Hold on, please.
I'm sharing the screen already.
Yes, I want to move. Talking objectives of this topic. At the end of the topic, I expect the participants at least to be able to know what toothwear is, tell the types of toothwear, to be able to know the causes, what causes tooth wear, and how to prevent this disease. So this is our outline for today. Introduction, we have definition, prevalence of tooth wear, types of tooth wear we have, what causes it, and how to prevent it, then conclude. Please, next slide. Sorry. Okay. Tooth wear is usually a physiological aging process, like Mrs. Durudola said earlier. It is physiologic, it's not a disease. We can't categorize it as a disease state because it happens in almost, you see it as we age. And it has been affecting mankind for centuries. Like, you know, when we have children, when we give birth to children and they start bringing out the first set of teeth, we have this at the edge of the teeth. If you observe, you have like something round. It's not flat. The way the front teeth is flat like this when we're growing up, it's like we have like something like a marmelon. We have something like marmelon at the tip, at the edge of those teeth. So this marmelon, with time, as the child begins to bite, it flattens out. And that's why we see the surface of the incisor, our front teeth flattens. So it happens even in young children as we are using. It's like when you start wearing a new shoe, over time, you see that there's wear. That's what we're talking about. There's wear. It's, of course, it's not significant in the early stage, but later it becomes so significant. And that's why it's also obvious in age, where as you age. It is accepted that a degree of tooth wear occurs naturally with age, like I've said earlier. And it is usually due to combination of processes. We have different types. These are the processes: erosion, we have attrition, we have abrasion. Those are the things that causes tooth wear. We'll talk about them. Don't bother about the words. I'll break it down. Although it is unusual to have a tooth wear that is solely attributed to a particular cause. So when we see tooth, or you can't say, okay, this is significantly the cause of this tooth wear. All the factors come into play. We have erosion, attrition, abrasion coming into play, but one predominates over the other. That's why we can say, okay, this is attrition, this is abrasion, this is what is happening here. So there are different factors come into play, but one predominates over the other. Then excessive tooth wear, however, can be exceedingly damaging. It can cause painful symptoms. Some people, when their tooth wear, when there's no a gross wear of the teeth, you start having sensitivity when they take cold water, because teeth has 3 layers. There's the enamel, the layer that we see outside. There's the second layer, which is the dentin, and there's the pulp, the inner layer that carries the nerve supply. The enamel that we are seeing outside, that white one, you know, it's very strong, it's not sensitive, and that's why it can flourish well in the oral environment. The next layer, that is dentin, is a bit yellowish and is very sensitive when it's exposed. So when the enamel wears off, when we are having wear, it's the enamel that first wears off. When the enamel wears off, we have the next layer, which is the yellowish dentin. And that layer can be very sensitive, that when you take cold water, you feel sensation. Some people, when they take, when they open their mouth in AC or air condition or cold, you feel this sensation. And that's why we are talking about that. It could cause painful symptoms. Even looking at it, it won't look good. There's poor aesthetics. It doesn't look good. The person doesn't want to smile. And it can even progress as far as bad as to have, you can have problems with eating and speech. The next slide, please. So what is tooth wear? Simply, tooth wear is defined as loss of tooth tissue by means other than bacteria. You know, usually what we see when there is loss of tooth is, most times we see cavity. Most times people, I know you're familiar with cavity, as they say, I have hole in my teeth, I have cavity. That is caused by bacteria. It's also a loss of tooth because there is cavitation. Tooth tissue in that side is lost. But in case of tooth wear, it is not due to bacteria. It's defined as loss of tooth by means other than bacteria. And it can also be defined as non-carious destruction of teeth. It is not caries. That's why that cavity that we are seeing is caries. This one is not a carious lesion. Next slide. Prevalence of tooth wear. Tooth wear has long been a recognized phenomenon in adults, and it's ascribed to attrition, abrasion, and erosion, like I've said earlier. There was a study in OAU, Teaching Hospital Ilefe, that found about 65% of the sampled population have tooth wear. Like I said, Tooth wear, you will find it in almost all age groups, just that it's predominant in aged people. The occurrence of tooth wear has also been found to increase with age. This occurrence increases with age, and there has been a gradual realization that younger people may also be increasingly affected. Younger people can also be affected, though it is more predominant. Next slide, please. It is more predominant in the aged. So there are 4 types of tooth wear that we'll talk about today. We'll talk about erosion. There's another one, attrition, abrasion, and abfraction. Next slide. Erosion. What is erosion? Dental erosion can be defined as loss of hard tissue by chemical means, notably acids. Loss of dental tissue by chemical means, notably acids. You know, what happens is that the tooth is a very strong, the enamel, that white thing they are looking at, it is very strong, and it is found to be stronger than bone. But at a pH of 5.5, the tooth dissolves. It can dissolve and soften and wear off. So acids that are involved in the erosion process are non-carious origin, and they can be intrinsic or extrinsic. And these acids, depending on the location where the acid is coming from, that's why you see the different types of erosion. Erosion could be from inside, intrinsic, and it could be from outside. So I said, okay, what are the things that causes erosion? Next slide, please. We said erosion is loss of tooth by chemical means, such as acid. The things that causes it could be ingested acid, such as fruit juices. You know, most of us like to take fruit juices and sports drink. These things, they are very notorious to cause tooth wear. They have been found to be able to cause tooth wear because the critical pH of a tooth substance, like I said earlier, dissolves at 5.5%. And these acids have a pH that is much more lower than 5.5. So that's why they can be able to cause tooth wear. However, if we ingest these acids like fruit juices or sport drinks, and it comes in contact with the dentition, it may affect the entire dentition, or it could sometimes be the anterior part of the teeth. As you are drinking it, it's coming in contact with the front of the teeth. So it can affect this anterior part of the teeth. And we're talking of fruit juices like citrus, fruits, sour foodstuffs. They often contain vast amount of acids in the form of citric acid. Also, carbonated drinks. Carbonated drinks like all those Coke, they are found to have contain phosphoric acid. And this phosphoric acid is also acid. So when we say acid, we're talking of something that is less than 7. So, and we say tooth dissolves at 5.5. This acid varies and their pH varies. So at pH of carbonated drinks or citric acid, phosphoric acid or citric acid, that is produced, phosphoric acid from carbonated drinks, citric acid from our citrus fruits, juices, their pH lower than 5.5, and they can cause tooth wear. The significance of this acid causing tooth wear comes in the mode of consumption and in the frequency of our consumption. You know, some people, they can just be sipping the drink, sipping it gently, you're sipping it, fine, it's good. But the more it is coming in contact with the tooth, the more it is causing the wear. You know, regardless of the kind of fruit juice, if most times when we ask patients to use straw, if you are having symptoms of tooth wear, because when you use straw, it doesn't come in contact with your teeth. You are taking it directly into the intestine. But when you continue to sip it and it's coming in contact, and like all these orange, rough edges of orange, you continue to eat it, it causes wear of the anterior surface of the tooth. Another type of, another thing that can cause erosion is chronic alcoholism. Chronic alcoholism is a condition that has also been linked as a cause of dental erosion, both intrinsically and extrinsically. Fine. In all this alcoholic wine, they have acids that are less than, that the pH is less than 5.5. And by direct contact with the mouth, they can cause tooth wear over time. As you take it with time, then you discover that this thing is already causing tooth wear. Then the other way that chronic alcoholism can cause tooth wear is that it can reduce the buffering ability of the saliva. The saliva in our mouth has a protective function. It protects the teeth from where it protects, it has like a buffering capability. It buffers the tooth. So by a chronic alcoholic now, causes the reduction of the buffering capability of saliva. Hence, it will cause tooth wear in such individual. Xerostomia is reduced salivary flow. There's a condition we call xerostomia. Some people, they don't have enough salivary flow in their mouth. Of course, I told you the function of saliva, that saliva has a buffering capability. It has you have a buffering activity. It has a function to protect tooth wear due to its role in pellicle formation. It can help to clear acid, and it helps in hard tissue remineralization. That because saliva has calcium. Saliva, one of the constituents of saliva is calcium, and this calcium helps to calcify teeth. So even when cavity wants to start, when something wants to start, then enough salivary flow can cause calcium to remineralize that thing, and that tooth, and the tooth will still remain. But when there's low salivary flow, like in xerostomia, salivary flow is low, so all those function of saliva is not there, and the person, it can subject the person to tooth wear. Another cause of tooth wear by erosion is vomiting and bulimia nervosa. These are vomiting, the process of vomiting. You can see vomiting in pregnant women. Some people, they just have this condition whereby they just vomit. That's bulimia nervosa. It's a nervous condition. They just vomit, tendency to vomit. And when you vomit, acidic content, the content in the stomach, of course, we know is acidic. When we have taken in food and the enzymes in the stomach has mixed with it, okay? It has this capability to cause, and then when the food is coming back into the mouth, it's more acidic than it went in, because the acidic content of the saliva has mixed with it. And so in this case, when food is coming back into the mouth, it causes tooth wear because it's more of acid. The acid is less than 5.5 pH. So it causes tooth wear, it causes erosion. Then another important point is gastroesophageal reflux disease. It's a kind of disease whereby people just bring back the food they've eaten back into their mouth. It's a condition. It's like a syndrome. They just, when they've eaten, after some time, they just bring out the food back, then take it back in. As the food comes back, like the reflux, the acidic content of the food can also cause tooth wear, just like in the case of vomiting. So next slide, please. So the next slide will show us the picture. We'll see the picture of erosion. You would have seen people with this kind of teeth. You can see there's wear off. This teeth was not like this. You can see the yellowish part is already showing. And that yellowish part is the dentin. This kind of people will suffer, somebody with this kind of teeth will be suffering sensitivity, sensation. With time, there will be insult, continuous insult to that teeth. It will result in pain and loss of the teeth, because people will come and say, please let me take out this tooth. It's giving me problem. But it has started gradually. It's not teeth problem, like I used to tell people, it's not something that starts just one day. You might have started over time, over a long time. It's wearing, you might not notice. With time, the first sign you will start saying is that you are having sensitivity, and it could be as bad as to air condition. When you open your mouth to cold water, you feel shocking sensation, and you won't want to do any of such things. So this is an erosion due to gastric regurgitation. You can see the pattern. When the food is coming back into the mouth, it's touching, those are the surfaces it touches first from inside. So that's why the erosion is more in that inside part. Now let's see the next picture. The next one is the ones that when you take acidic citrus fruit and acidic drinks. You can see this picture you are seeing is kind of erosion from acidic drink, because you are taking it from outside. The acidity, as you're sipping the wine, is causing erosion. You might not see it, but when you take a close look at that picture, you see that the surface of that tooth is getting wear. It's weird. That's not the way that tooth was. It's weird, and you can see the pattern of the wear. So, next slide, please. So that is that about erosion. So we'll be talking about the next type of tooth wear, which is attrition. The attrition is a kind of tooth wear that is caused by contact of upper teeth and lower teeth, contact of the two teeth, occlusion, during chewing. And so people have parafunctional ability, parafunctional syndrome, that they will just be grinding their teeth. Those are the things that causes attrition. This is a kind of tooth wear that we call attrition. It's normal physiological action when teeth are grinding food together during chewing. Of course, we chew. But some people with parafunctional habits, such as bruxism, this bruxism is like they will just be chewing their teeth. They will have attrition-related tooth wear, and it can be very significant. You will see it. The patient often have flat incisor. Their front teeth is shorter. You can see it's shorter than the normal teeth. They have short incisor and flat occlusal surface, and they have loss of surface texture and morphology on the affected tooth. Let's have the next slide. So what are the things that causes this attrition? We said attrition is caused by up and down chewing, normal chewing, but with time, over chewing hard things, chewing the teeth. Some people, when they sleep, they are just grinding their teeth together. It's a kind of, they kind of use it to cope with stressful condition. So when they are in stress or when they are doing something, you see them clenching their teeth. It's not, or they're writing or they're serious. You see them clenching their teeth together. Those are kind of tooth wear that occurs when such things happen. Bruxism is a habit that is developed often as a coping mechanism for stress. And as a result, people may go through periods of activity. Sometimes they do it, sometimes they are quiet. They do it, they are quiet. They don't even know, most times, they don't even know they are having such abilities. When they are stressed, they just start doing it. It could also be caused by psychosocial behavior, such as an individual's stress adaptive capacity. Like I said, some people use it to cope with stress. When they are stressed, they just start grinding their teeth together. And this is what you see in attrition. You see the surface of the, you can see this is not a normal tooth dentition. The teeth is already short. The incisor edge is already short. And in these people, in this kind of people, they will also be having sensitivity. You can see this type of tooth wear is different from the ones that are caused by chemical. The one that are caused by erosion, you see it, you will see the tooth wearing out on the surface. But this one is the incisor edge because they are grinding. It's that surface that contacts the other tooth that is shortened. Okay, let's move to the next type of tooth wear, which is abrasion. This is usually very common. Loss of tooth substance caused by action of foreign objects or rubbing against the tooth surface. This you will see in people that use toothbrush. They will use toothbrush to be scrubbing and not even doing it the right way. And then so you see some people with very hard toothbrush. Normally, you know, we recommend medium bristle toothbrush. There are different types of toothbrush. When you get to the supermarket to buy your toothbrush, you buy toothbrush with medium bristle. They will write it there. They're soft for children. There is very hard. Those very hard, so people, that's what they will go for because they think it helps the teeth to be used, you know, it helps them to clean better. Of course, it's not. What it does is that it causes tooth wear because it's very hard, it's too hard, and they continue to scrub it. Also, some dentifrices, some toothpaste have very coarse particles, and you can see them that it's very coarse that when you are scrubbing it on the surface of the tooth, you see that it can cause wear. Also, food stuff. Hard stuffs, people chew hard stuffs. Some people use dental floss wrongly. Those are the things that can cause abrasion. And the abrasion, the wear is often located along the cervical margin of the teeth. When I say cervical margin, please let me go to this slide 17 there. Cervical margin, I want to show us what cervical margin is, that picture. I want to show us, you can see the wear, you will see it here. Can see the way because they are brushing and they are brushing horizontally instead of vertically. They will kind of scrub off with aggressive brushing. This is what you have in, and this is very common. Sometimes it is mild, sometimes this is a very rare, this is very at the extreme, because this person would have been using something to brush that very hard brushing wrongly with the wrong technique, and that's why it came down with such. Please write slide 16, ma'am. Want to look at the causes of abrasion. What are the things that causes abrasion? Like I said earlier, most abrasion is located in the cervical area of the teeth, and they are associated with tooth brushing. Number one, I said type of brush bristle. The brush bristle is very hard. There's incorrect or over vigorous brushing. They are brushing incorrectly, going horizontally instead of vertically. And this is with even a vigorous force. And the toothpaste, the paste could also be abrasive. Some people use very hard, ash toothpaste, whereby you see it, it's not minty and fluffy the way normal toothpaste is used to be. They think that scrubs better and that makes their teeth cleaner. That's not what it does. It causes abrasion. You know, it's been found that the orientation of toothbrush influenced the wear of teeth. And when you brush horizontally, it is suggested to cause as much as 2 to 3 times more tooth wear compared to when you brush vertically. We advise people to brush vertically, up, down, up, down, because the fibers of the gum are arranged longitudinally. So when you are brushing horizontally, side, you are destroying the fibers, thereby destroying the tooth on that region, and you have cervical abrasion, like we have seen in that picture. Abrasion can also occur as a result of overzealous brushing, like I've said, improper use of dental floss and toothpick, or detrimental oral habits, such as chewing tobacco. Some people chew tobacco and they use it to brush their teeth also. Also, biting on hard subjects, biting on hard objects like pins. Like you see tailors, they use pin to hold their the pin they are using to sew clothes. They use their teeth to hold it. Pencils. Some hairdressers use their teeth to open hairpins. All these can cause abrasion. Frequency of toothbrushing. Some people can brush more than 20 times a day. We don't recommend that. We say brush morning and night. There are reasons why we say that. So when people brush too much and with so much vigor, thinking that it will cause, it will help to clean the teeth better, it will cause abrasion rather than clean the teeth better. Then abrasiveness of toothpaste, like I said, toothpaste could be harsh, then wrong brushing technique. Thank you. Please, can we go to the picture, slide 17? Slide 17, we've seen it earlier. That's the picture of an abrasion. The next one too, this is a mild abrasion. It has started, but you might not have noticed. You can see the gum is already up, and that yellowish part that is exposed is not supposed to be exposed. The white part of the teeth is what you are seeing. That's the enamel. That's what should be seen. When you begin to see this yellowish part that is close to the gum, you are already having abrasion, and this is still in the early stage. Though it has progressed, but it's not as bad as the first picture that is shown. Slide 19, please. So the last one is abfraction. Abfraction may not be, you may not see it clinically. The causes is not what you can see physically, but it's caused by stress, tensile stress that is generated from occlusal loading. You know, there's what we call cervical enamel rods inside the tooth, and when it fractures, there's microfracture of this cervical enamel rod. This is what causes abfraction. It's not commonly seen, and usually it looks like abrasion. Most times it's usually just diagnosis as abrasion. There could be microfracture of cervical enamel rod, except an investigation is done. Usually V-shaped lesion and can be missed for abrasion, just like abrasion. Let's see the picture. You can see it, the next slide, looking like, you can see it looking like abrasion too, because this is what abrasion we also do, but this abfraction lesion at the gum line. You can see similar. Let's move to slide 21. Slide 21. How do we prevent tooth wear? What are the things to do to prevent tooth wear? We should make effort to eliminate or control the causes of tooth wear, so we can prevent tooth wear from their causes. I've told us what are the things, I've told us the things that are causing tooth wear. So let's just tackle it from the point of what is causing it. Let's take out what is causing it. Erosion, we said acidic food, vomiting. Cut out acidic food. And when you want to take these acidic foods or juices, let's use straw. So people that have had signs of tooth wear, it's better to actually use straw so that the acidic fruit doesn't come in contact with the tooth, and it at least will reduce its frequency of coming in contact with the tooth substance. So we advise that you brush twice daily. And when people vomit, they should rinse. And when even some people that have reflux, this regurgitation reflux that I talked about, that bring back their food, when that happens, they should rinse, because when it happens like that, and the food that was brought back and taken back into the mouth is not rinsed, you know, the contact time with the tooth is increased, and it can be causing tooth wear. Then, how do we prevent attrition? Avoid biting on hard objects or grinding on teeth. Some people, like I said, attrition is when you bite on hard objects. Tooth wear that is caused by biting on hard objects or grinding on teeth. So when we avoid grinding on our teeth or biting something hard, very hard. Of course, say people chew bone, that will not be always, but some people, they just they bite on hard things consistently, maybe especially the occupational people where they continue to put pain in their mouth, they hold it there for long. Those things can cause attrition. Then we should reduce stress, because it's stress that is always causing people to continue to, because they want to use it to cope with their stressful nature. Then usually we prescribe night guard for such people when they have attrition. There's something we wear, they fabricate for them, they wear in the mouth to protect the contact, the upper teeth from touching the lower teeth. And we find that mostly bruxism that causes wear from attrition usually occurs at night. When people are sleeping, they do it, or when they are under stress. So we ask them to wear this night guard. So their teeth, the upper teeth and lower teeth does not contact. Instead, it's the night guard that will contact. They wear it up and down. It will contact itself, themselves, and it won't have any contact with the tooth. So it will prevent tooth wear. Abrasion, how do we prevent abrasion? We should use medium bristle toothbrush with minimal force. Not hard one, not very forceful. The force should be minimal, so help keep the teeth clean. Then we should avoid abrasive dentrifices. Some dentrifices could be abrasive with very sharp particles, which will cause wear, like we have said earlier. Then we should use fluoride toothpaste. At least fluoride will help to remineralize. Fluoride will help to remineralize the tooth and protect it from having a wear. So next slide. In conclusion, I will conclude by saying it's important we know the cause of tooth wear and avoid it. Like we have known today, we should avoid all those things that we have said can cause tooth wear. We know, like I said earlier, that tooth wear can cause loss of function and can be aesthetically unpleasant. When you see people with tooth wear, most times they don't like to smile. And when you want to do management of tooth wear, when it's so bad and you cannot smile and it's already affecting the aesthetics, you can spend millions to correct the aesthetics. Because they won't be able to smile, they won't be able to open their mouth, they will be so, the self-esteem will be low. And this, we don't want this to keep happening. So, and when tooth wear is noticed, it's better you report in the dental clinic early enough so that it does not get worse. So thank you for listening, and that will be the end of the lecture.
Wow.
Now.
This is loaded, though very short, loaded, very informative, very educative. I'm sure we have questions. So the floor will be open now for question and answer. You can type your question, you can signify, and then you will mute and ask your question. So the floor is free now, we can ask questions. Okay, Mrs. Bolanle Toyin Moses. Please unmute and ask your question.
Okay, good morning, ma.
Morning, ma.
Yes, ma. Thank you so much for this beautiful educative session this morning. We appreciate you, our facilitator. I just want to ask, is there any adverse effect of cold water on our teeth?
Okay, should I go ahead and take that?
Yeah, take that.
Cold water on the teeth does not have any particular adverse effect, but when you start having tooth wear, what it does is that you won't be able to take cold water. And that's why we are saying we should prevent tooth wear. You can take cold water, but when you start having tooth wear, you will start feeling sensation when you take cold water. So it's better we prevent ourselves from having tooth wear. So we can continue to take cold water for as long as we want to take it.
Thank you. So it is the same with all other cold drinks. We should prevent by avoiding cold drinks generally.
I did not say avoid cold drink. I said if you have tooth wear, if you're having signs of tooth wear, when you take cold drink, what it does is that it will give you sensitivity. You will have shocking sensations to cold water, cold drinks. It could be as bad as to AC. So people won't be able to open their mouth. That's when tooth wear are setting. But if you don't have tooth wear, you're protecting yourself from having tooth wear. You can take cold water for as long as you can.
Thank you, ma.
Cold water is not bad. I didn't say it's bad to take cold water. It doesn't affect you in any way. But if you have tooth wear already, you will have sensitivity from taking cold water. You won't be able to take it.
I can see the 20th of service. She has a question. You can go ahead, ma.
Yeah, thank you very much. Good morning,
Good morning,
the doctor.
Good morning, ma'am.
Good morning, everybody. Well, I want to appreciate the Office of the Head of Service for giving us the opportunity to listen to this sort of, I will call it sermon. Yes, I will call it sermon because it's so useful to us. But I will also advise that the Office of the Head of Service can consciously add this type of program to retreats, those who are still in service. Because when you talk to us, those of us that have retired, most of us are above 60, all we can do is just to repair. The damage has been done. Because I learned my lesson very late because I love to eat bone. I love to eat bone. So by the time I cultivated the idea of going to check my teeth, I was told that most of my teeth are broken because of eating of bone. So I think that if I had known earlier than this, maybe I would have made the correction. So I think it is advisable for the office to include it even during seminars. Dental person can come in to just give 5-10 minutes talk, so as not so that we can the people can take maximum advantage of this type of talk. Then the other one is that, you know, when I remembered when I was having my children, my mother told me that if you are in labor, that you should try as much as possible not to vomit. And she said that if you vomit, that it will affect your teeth later years. Is it a myth or is it true? That's my question. Thank you very much, the doctor. You have really done well. God bless you.
Thank you very much, ma. Thank you, ma. Well, vomiting, and like I said, vomiters generally, whether you are in labor or whether you are pregnant or anytime someone vomits, anything that is coming from the stomach is acidic because the nature of the enzymes in the stomach, immediately food gets there. In the next 3 minutes, the food is acidic. You know, so when the food comes back into the mouth as vomitors now, it comes in contact with the teeth, and over time you start having tooth wear when that happens. I think pregnant women, when you vomit, that will be once in a while, but some people have the habit of vomiting continuous vomiting, you know, and it can, with time, like I said, dental diseases does not happen immediately. Over time, when this thing persists over time, tooth wear is something that will come gradually until it becomes visible and you start seeing it. So vomitors can cause tooth wear. Might not be during labor, it might be during pregnancy, like we talked about vomitors now, and people that have reflux syndrome that brings food back into their mouth after eating. So it's still the same thing. Vomitors is vomitors. It is acidic in nature. It can cause wear.
Thank you very much, doctor. I have another question here. Somebody said, how can receding gum be managed and improved upon?
Okay, when gum is already receded, you know, we talked about what causes gum recession by people brushing horizontally and not vertically. Like when you brush horizontally, it's been found that it causes 2 to 3 times more wear than when you do vertically. So when recession is already there, there are 2 things we can do. There's something we call gingivoplasty. We don't usually do it here. Gingivoplasty is whereby we carry like doing plastic surgery. You know, you get tissue, gum from somewhere else. You know, the mouth heals fast. You get gum from somewhere else, which we heal later, and you transpose it and use it to cover that part. Or you open some part of the gum and use it to cover that part that is exposed, and it heals. They do it very well in other part, in the western part of the world. We call it gingivoplasty. But what we usually do here when it happens is that we cover that part that is exposed, because when gum recedes, the root begins to expose. And when the root is exposed, it causes sensitivity. You begin to have sensitivity also. And that's what brings most people to the clinic. We now use a material we call composite or any other material that is aesthetic, that is the color of your teeth. It's aesthetically pleasing. We use it to cover it so that there is no continuous insult to that exposed part, and thereby causing sensitivity and resulting in loss of that tooth. So, like I've said now, we do two types of treatment. We either do gingivoplasty to cover the exposed part of the tooth, or we cover that part of the tooth with teeth material, white material. Do you understand the answer now? Is that understood, ma'am? Please let me, if the person wants me to explain further.
Okay. That question is from Mr. Nuga. Mr. Nuga, are you clear with that? You can unmute, sir. You can unmute. And then I have another question here. It says, is chewing of gum advantageous? Chewing of gum, is it advantageous?
When we ask people to chew gum, we talk about sugarless gum. There's a sugar-free, rather. We call sugar. There's a gum that we call sugar-free. Your gum contains sugar, and we used to advise people that don't let sugar come in contact with your teeth for long, because sugar is one of the things that cause cavity. It's one of the prerequisites to cause cavitation on the tooth. So when we say chewing gum, we advise people to chew gum because, of course, when you chew, some people, we need jaw exercise. We need them to exercise their jaw sometimes. We prescribe sugar-free chewing gum. But when you chew gum, sugar chewing gum, everything is in moderation. If it's not too much, it shouldn't cause any problem. But when we prescribe chewing gum, we prescribe sugar-free chewing gum for advantage of jaw exercise, for people that cannot open properly, that needs to exercise their jaw.
Okay. Thank you, Ma. Any more questions, please? Any more questions? Okay, somebody said, when one tries to get rid of tooth decay, can it cause erosion? So when one tries to get rid of tooth decay, can it cause gum erosion too?
No. Tooth decay is something else. Tooth decay is loss of tooth by bacteria, cavitation. So when we're trying to get rid of it, what we do is we just fill that tooth. We fill that part of tooth that is lost with tooth filling material that is hard, so that that person can still maintain its function of mastication, chewing. So that wouldn't have anything to do with tooth wear.
Okay.
Trying to restore cavitation does not have to do with tooth wear.
Thank you very much. Any more questions?
Okay, I'm seeing a question on the screen.
Okay.
Somebody said, I want to ask if it is advisable to take any supplement to prevent tooth wear. Like our former HOS said, the advice is now a little bit late to some of us. We are now victims, okay? Like supplement to prevent tooth wear. What we prescribe generally is just use fluoridated toothpaste. You know, some people use this herbal toothpaste. This herbal toothpaste, they don't have fluorides. What fluoride does to teeth is that it helps to remineralize. When tooth, even if there's anything that is happening, if a cavity wants to appear, if wear wants to happen, the fluoride still helps to mitigate against this wear to some level. So fluoride helps to mineralize the tooth. That's why we always prescribe fluoridated toothpaste. Herbal toothpaste has no fluoride. Some people come up and say, okay, I've used it, it's good for me, I like it, but we don't usually prescribe it. We prescribe fluoridated toothpaste, which helps to remineralize tooth. Any other supplement, anything that fluoride that we're about. Your toothpaste, brushing with your toothpaste alone can help, and brushing morning and night will help to keep your teeth okay.
Okay, thank you. Any more questions?
Somebody said, how do we identify a toothpaste with harsh content? I won't mention any toothpaste here, but some toothpaste, when you put it in your hand, you will see the particles sharp. All those, maybe some herbal toothpaste. When toothpaste is not sharp, all those, when you take all those close up, you know that they are fluffy. You don't see particles. We have some toothpaste that you feel particles inside. People think it helps to clean better. Those things will cause wear. When you feel particles in toothpaste, it's not so sharp, it's not so smooth and fluffy the way it should be. It has particles. It means it's abrasive. Do you understand that question? It means it's abrasive, it's harsh. What drinks do we use straw for? Acidic fruit juices, citrus fruits, they have acid. All these fruit juices with citrus, acidic drinks, they have acid. So we should use straw for them. If you know you are somebody that likes juice so much, some people, they take juice once in a while. It's not something that you take consistently, but some people can take juice consistently and put it in their mouth and be sipping it over time. If you are such person that drinks juice all the time, that you like to take acidic juices like citrus fruits, you should use straw. If you are once in a while person with juice, you can still try to go with it, but if you take it consistently all the time, you should use straw.
Okay, let's take one more question. Is there any question? One more, just one more.
Then lastly, I want to say that if we have no question, or if any question is still coming up, we should do our routine checkup. Most of us, we don't do checkup 6 monthly. We should walk into the clinic, in the dental clinic, walk into the dental clinic and do a checkup. It's not compulsory you have pain. It's not compulsory you have, when tooth wear begins, even when cavity begins, you don't know. You cannot see it until it has formed the cavitation. But there are processes or stages that the cavity goes through before it forms cavitation. So when you come, we can use our probe, our instrument, to check it, and we see it even before you notice it or start having any pain. You would have seen it that you have a cavity on this tooth. This tooth has a cavity. Try to plan to feel it. But most people, we wait. We wait until the cavity, even if we have the cavity, we don't stay calm until we have pain. And that's why most times when most people come to the dental clinic, it's the last resort. It's either they are extracting the tooth because it's bad. Most people that come to the dental clinic will come for extraction. They won't come for, but now, well, because the advocacy is getting more, that people come for routine cleaning. People come for routine cleaning. But most of the time, you see people, when they come down with pain in the dental clinic, they are coming with a very bad pain that has gotten to the last stage that we can't salvage the tooth any longer. Somebody said, what's the medical benefits of Pako Ijebu and other chewing sticks? Fine, Pako Ijebu has its benefit and other chewing sticks. We won't say, because these are traditional things that we have met. These are things that we have met there. We won't say people should not use Pako Ijebu. But when you are using Pako Ijebu, there are some things that you are supposed to do, but you won't be able to do it. If you can take the Pako Ijebu and after chewing it, you chew it for like 30 minutes to 1 hour, and you have formed bristle. When you have formed the bristle, then you use the bristle, you take your teeth one after the other. One after, do you do that? When people chew Pako Ijebu, what we see them do is that they just chew the thing. They're not using it to clean. They just chew and rinse it and rinse their mouth. That's not, if you want to use it to be effective with it, after chewing for like 1 hour to form bristle, then you pick it up and use it to start cleaning the surface of it, one after the other, the lingua, the palata, you clean the surface. Then we advise that if you can do that, after doing that, you can now brush. You can brush. Pako Ijebu is beneficial. It's beneficial, I won't doubt that. But we advise that you can put toothpaste on that bristle also. Put your toothpaste on it so that you have fluoride and use it to brush. Because by chewing on it, you have formed bristle. So if you have formed the bristle, you can put your toothpaste on it and brush one after the other. You know, it will take, can you spend 3 hours brushing in the real? Because if you want to use Pako Ijebu effectively, you have to be spending close to 2 to 3 hours to do that effectively. That is that. Somebody said, some people use smoker's toothbrush. Is this in order? Smoker's toothbrush. What people refer to as smoker's toothbrush is the hard brush. There are 3 types of brush. We have the soft one, we usually advise for children. We have the medium one that every other person should use. Then the hard brush, smokers use it. In fact, we are discouraging smokers from using it now because the benefit, the risk, the disadvantage is more than the benefit. When you are using a hard toothbrush and you are having a lot of tooth wear, by using it, you are having a lot of tooth wear. So we advise you to use medium. We're advising to smokers to use medium toothbrush rather than use hard now, because we see that the disadvantage, the risk is greater than the benefits. It causes more tooth wear than it will clean their teeth. So that if that's worth taking, the question here is, if the cavity is not filled up, what is the effect? If cavity is not filled up, because when cavity starts, when we see a hole, it's on the enamel, we say, okay, fill it. If you didn't fill it, it progresses. Like I told you when I started, I said tooth has 3 layers. The outer layer you are seeing, that white one, is the enamel. The second layer that is inside is a bit yellowish, is the dentin. There's the third layer that carries the blood supply and the nerve supply. That is the pulp. So when it is in the enamel, you didn't feel it, it progresses into the dentin. It starts giving you sensitivity, shocking sensation, you can't chew. It progresses into the pulp, to where the nerve supply is. And then that's when you will start feeling bad pain, because it has attacked the nerve. You can't be able to chew. It can progress to swelling. Your mouth can swell. People die from teeth, from cavities, if not well taken care of. So it's better when you have a cavity, you have it filled.
What actually causes tooth worm? That's another question.
Tooth worm. What is tooth worm? There's what I believe these people call tooth worm is the bacteria. There's no worm in the teeth. We have bacteria, microorganisms that cannot be seen with the visible eyes, and those are, they are present in the mouth. Microorganisms are present in saliva. They are present in the mouth generally. They won't cause any havoc. But when things that what will make them to start causing havoc, they are normal in the mouth. But when you now have, when you chew, you eat your food, it's left over in the mouth, leftovers in the corners of the mouth, you didn't brush at night, that one is there. The environment of the mouth is quiet at night. These microorganisms feed on the leftovers in the mouth over time. Those are the factors that come to play: time, microorganisms, the sugar of leftover foods in the mouth. They come to play over time. The microorganisms rather feed on the leftovers in your mouth. And when they feed on the leftovers, what they produce is acid. So it's that acid that causes cavity. So like I said, there's nothing warm, it's microorganisms that we have in the mouth, and they are normal. So when you brush your teeth at night, you have reduced your risk of developing cavity to about 50%. Because every leftover in your mouth at night, you have brushed it, you have no leftover. Microorganism is there in the mouth. If it doesn't have anything to feed on, it doesn't have anything to take to produce acid, and you are gone. You won't have to develop cavities. So that's why we say brushing at night is even much more important than brushing in the morning. But most of us, we want to brush in the morning because we think it makes me feel fresh. Fine, brush in the morning, but brushing at night, if you can brush at night, you can give that morning away. But brush twice daily, morning and night. It's very important.
So thank you very much, Doctor. I think there are no more questions. Nobody is signifying, nobody is typing any question. So I want to believe that. Okay, another question is coming up. Is this microorganism or bacteria in the mouth transmissible? Is it transmissible?
Of course, when people kiss, microorganisms can move from mouth to mouth. Okay. During kissing, so it's transmissible. Right. But you will of course know that it won't. I think is in most cases in terms of kissing, because like I said, microorganisms they are in the mouth. They are normal. They are normal flora. You have it in your mouth, the other person have it, and they are the same type of microorganisms. So we can't be talking of because somebody is not that somebody is sterile and the other person is not sterile, and the person that is sterile is not sterile is transmitting the disease. So it's both in the mouth, so it can be transmissible. It's normal in everybody's mouth.
So thank you very much, Doctor, for this very educative session. I enjoyed it myself. There are so many things I've learned. On this note, let me call on the permanent secretary. I'm sure he has one or two things to say, or even before then. Let's see if somebody has a comment. Maybe a comment or appreciation to the facilitator. Any comments? Okay. Okay, let me just call someone to appreciate the facilitator. I can see Mr. Bada, GOC. Please unmute, sir, and appreciate our facilitator for today, Dr. Lawrence Ayeni.
Dr. Olasumbo.O, Ayeni, thank you very much for this very insightful deliberation. Like the former head of service mentioned, it's a sermon for not only those that have gone out of service, but for those who are those who are still active. I'm sure I could see one or two or three of them who are participants in this webinar. Well, thank you. I thank you personally, at least who are gone after above 60. Thank you. And God bless you.
Amen. Thank you so much. At this point, I would like to call on the PS, Mr. Samson Ajibade, for his final comment. You can unmute, sir. Please unmute. You can unmute, sir.
Hello?
Yes, you are audible, sir.
Let me also join in appreciating the Dr. Ayeni for a job well done. My area of interest has been addressed, and that is when somebody asks concerning Pako Jebu, Oniata, Pako Orogbo, and the rest of our traditional chewing stick, which we know very beneficial, like you agreed, and which our government has been using, and they don't have problems, dental problems like we are having nowadays, because most of the acidic food and drinks we are used to. So I want to appreciate you. It was well presented, and we all benefit from the, as called by the former head of service, someone from the pulpit, but this time from the pulpit of the medical church. I also want to appreciate our elders, our fathers and mothers who participated. I can see Alhaji Ajibola Olagbaye. I can see him as one of the participants. My Egbon and senior colleague, J.O. Koka, JOC. I can also see him as part of the participants. So I want to appreciate every one of you. And your involvement, my friend, GOC, individual and severally, like I used to call him, who asked the question if the microcosm, and I know that area of specialty can be transmitted, but I think he knew that I know where he's going when he asked the question. I told somebody beside me that GOC is talking about kissing. So for participating, and also I'm going to appreciate the lecturer. Thank you very much, GOC. God will continue to bless each and every one of you. For all participants, I wish you all the best, that as senior citizens, God
are no longer audible.
Oh.
True.
Okay. You are audible now.
Hello.
Yes, you are audible
God
now.
bless us
Yes.
all. Thank you, everyone. I've made my comments.
You are not audible. You are
Towards the
not
half of
audible at a point, sir.
I have appreciated the facilitator, Dr. Ayeni. Thank you for a job well done. God will continue to increase you in knowledge and
Amen,
wisdom.
sir. Thank you, sir.
And I want to appreciate all the senior citizens who participated. I can say Alaji Olagbaye. Thank you, sir. Former HOS, Mr. Bada, GOC, who asked the question of kissing. So we thank you for participating and all others. And I said the question, my area of concern has been addressed.
Again, no.
And that is the issue of Pako Jebu, Oriata, Pako Rogbo, that we used to enjoy in those days, which the presenter also agreed that is beneficial to us. So I just want to admonish us that please encourage others to join us when we have things like this. It's beneficial to us, and we want our senior citizens to be very healthy and with sound health. So thank you all for participating. And on this note, on behalf of the head of service, we want to declare it closed. Thank you very much.
Thank you very much, sir. Thank you. And then thank you so much, Dr. Mrs. Lawrence Ayeni, for this beautiful session. I'm sure we've all learned a lot from this topic. I'm sure henceforth
we really enjoyed the topic.
Okay, teach better. Okay.
Is that not Engineer Baba?
Yes.
Yes.
Good afternoon, sir.
Morning, sir.
Good morning,
Thank
sir.
you for joining, sir.
Thank you for joining us.
We really enjoy it. Help us express and listen to the doctor. She has done perfectly well.
Thank you, sir.
She must be a genius.
Thank you, sir.
Thank you very much.
I appreciate you joining us, sir.
Yes, sir. Thank you.
So I want to use this opportunity to say thank you to all of us that have joined us for today's webinar, starting from the 20th head of service. Thank you so much, former president of the Alausa, Alhaji Olagbaye. Thank you, Engineer Anibaba. It's nice having you. I also want to say thank you to former permanent secretary, Mrs. Funlola Odunlami, who also joined us.
Wow.
And so many other PAMSECs. For some of us, we didn't, our names are not showing. It's maybe our telephones, numbers that are just showing. We want to say a very big thank you to everybody that has joined us today. We are glad to have you. It's a pleasure having you all the time. Please invite others to join this webinar. They are usually very educative, very, very educative. It's usually bi-monthly. And we usually have one focus on our health, and the second one on business. You know, we bring different people from different walks of life to come and educate us on their types of businesses. We believe that though we are retired, we are not tired and we are not old. So we can still do businesses and we can still prosper in our businesses. So on that note, I want to say a very big thank you to all of us that have joined. To close, I want somebody to just give us a closing prayer. Somebody to give us a closing prayer, please unmute and give us a closing prayer. Somebody to give us a closing prayer. Okay, I'm going to nominate someone. Mr. Sadu, please unmute and give us a closing prayer, sir.
We thank God for this exercise and for the lives of those organizing and the officials that are presenting the program. And we pray that we shall all live a healthy and wealthy life in retirement. And those of us who are still in service, we shall exceed gloriously.
Amen.
In God's name I pray.
Amen.
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 So thank you very much.
Amen and amen.
That will be the thank you very much, sir. That will be the end of the program for today. In another 1 or 2 weeks, we are going to have another notice, and that's going to be on business. So thank you for joining us for today, and bye-bye.
Bye.